Afternoon. Josh Jabal and Deirdre Gifford and myself just participated in a conference call with the White House COVID task force. That's led by Jeff Zients, includes Dr. Lewinsky from CDC. It includes Dr. Fauci of Fauci fame and some of the other experts who are, leading the COVID response on behalf of the federal government. As you can imagine, the pause and distribution of J&J until they investigate some of the side effects was a prominent piece of the discussion. Dr. Lewinsky said, of course, you want to err on the side of caution, a turn of phrase that a lot of us have been using over the last year. I think you should get some comfort from the fact that, early on they used to call it Operation Warp Speed, as if they were trying to get vaccines out as quickly as possible with some risk of cutting corners. That's not the case. And that's certainly not the case with the CDC. And that's not the case with the efficacy and the safety of the vaccines that are out there right now. Let's say there have been 6 severe side effects out of 6.8 million J&J doses that have been administered in the United States over the last many months. That's a 1 in a million chance of having that type of a severe side effect. 1 in a million. That's somewhere in the area of getting struck by lightning, or probably a higher chance, as somebody said, of driving to the vaccination site, getting into an accident. But that said, look, I salute the CDC for erring on the side of caution to give everybody that sense of confidence. A number of the governors thought, though, that the White House team was a little naive when they said, this is just going to be a pause and then we restart our engines. We're working really hard as governors across the country, and Josh and Deirdre and myself here, to give people confidence that it's the right thing to do to get vaccinated now. It's a million times safer getting vaccinated than pausing or waiting. General Mrna, who's handles the inventory and distribution of vaccine, he says there's been some pause and some inventory in different regions of the country in terms of people who aren't getting vaccinated, leading to some excess supply. That's not going to happen in Connecticut. I'm here to reinforce how important it is that you continue to get vaccinated. CDC is being cautious when it comes to the J&J. Josh has got the Mrna and the Pfizer going out. It's out in our FEMA mobile van right now. Those, small yellow ice cream trucks that we had on the road, they're going to take a pause today, just as we get more Pfizer and Mrna in there, no J&J. Good news is we're going to get extra doses next week of Pfizer and Mrna, so hopefully we're not going to miss a beat. And I don't want to miss a beat because some of you say, hey, here's one more reason not to get vaccinated. Yesterday, we had about a 3.8% infection rate, so that's good. We're staying within a narrow band there. But there's still 21 hospitalizations, 17 fatalities. Get vaccinated. You won't be one of those hospitalizations or fatalities. That's what I heard, Deirdre. What'd you hear?
Thank you, Governor, and good morning, everyone. Yes, to follow up on the governor's comments, just a few additional pieces of information for the public. First of all, we appreciate and understand that the announcement this morning from the CDC and FDA about a pause on J&J vaccine caused some concern. So I want to make sure that people have the facts and understand what this is about, what it's not about. What we are doing here at DPH with the governor's office and in partnership with our federal partners, and then what you can do in response to this news this morning. First of all, early this morning, the FDA and CDC together did issue a statement recommending this pause in distribution and administration of the J&J vaccine. They did that as a result, as the governor said, of 6 cases of this blood clot event called a cerebral venous sinus thrombosis. That blood clot has been seen in combination with a low platelet count And the combination of those two things in these 6 individuals is rare enough that they felt that they needed to make a pause and do some more investigation. So in turn, the DPH this morning sent a notice out to our providers also recommending that they pause the use of the J&J vaccine, and also letting providers, healthcare providers know that this rare event has been noticed, and that there may be some different ways for them to treat individuals if they should see this. Of these 6 cases, we are not aware that any have come from the state of Connecticut. We have administered over 100,000 doses of the J&J vaccine here in Connecticut, and as the governor said, nationally, 6.8, almost 7 million doses of J&J have been administered, with only these 6 cases being reported. So that's very reassuring as to the rarity of this potential complication. And I should emphasize that although there's an association and the FDA and CDC are doing this investigation, we don't know for sure about the relationship between these events and the J&J vaccine itself. So what can you do, or what should you know as the public? First of all, it's important to say that if you've received the J&J vaccine more than 2 weeks ago, like me, you can be reassured that these rare complications, they occurred between 6 and 13 days after vaccine administration. So if it's been more than a couple of weeks since you got your J&J vaccine, you can be even more comfortable that this does not implicate your particular vaccine. If you're somebody who received the J&J vaccine in the last couple of weeks, you can also be comfortable that this is a very, very rare event and not be overly concerned. But the advisory right now is that if you do develop unusual symptoms, a very severe headache, shortness of breath, abdominal pain, that you reach out and contact your provider. The other thing that you should know is that as we've been saying, the governor and Josh and myself right from the beginning, that certain side effects are common with these vaccines in the couple of days following administration. So headache, fatigue, low-grade fever, these are very common and to be expected and not serious side effects after the vaccine. This event, on the other hand, as I mentioned, happened between 6 and 13 days later. So if you just recently received any of the vaccines and you have some of these common and known side effects, you don't need to be overly concerned. Obviously, reach out and ask your healthcare provider if any of these side effects are serious or severe to make sure that you're communicating. And finally, I would say that we were informed this morning by the FDA and CDC that they have not seen this combination of this blood clot with low platelets with any of the mRNA vaccines. So those continue to be, as we've been saying all along, all these vaccines continue to be very safe. The governor alluded to the fact that all the things that we do in healthcare carry some risk, whether you're having a procedure, a surgery, taking a medication, and we weigh the benefits and risks. And as the governor said, we certainly know there are tremendous benefits to these vaccines. And there are certainly risks of getting COVID, getting hospitalized, or even dying from COVID. So those things need to be kept in mind as well. Back to you, Governor.
Thanks, Deirdre. Any questions?
The Day of New London, Sten Spinella.
Hi, everyone. Quick question for you, Governor. People who had appointments for J&J vaccines, are those going to get canceled, or are they going to be given a different type of shot?
You want to take that, Josh?
Sure. So our providers are all working this morning to address that exact question. What we're seeing is that many providers are successfully rescheduling those appointments to offer either Pfizer or Mrna vaccine, including the FEMA mobile unit, which is still in business today in New Britain, administering Pfizer. But there likely will be some cancellations, particularly among pharmacy appointments who were planning to administer J&J between today and tomorrow. So we're working, and Commissioner Gifford's team at DPH is working with all of our providers to rebalance, making sure that we can try to help move Pfizer and Moderna around to minimize the number of cancellations. There probably will be some, but we're hopeful that the number will be very limited.
And can I just add, Josh, first of all, I want to give a shout out to the team at Griffin who jumped on this morning and really quickly adapted and is switching the FEBA mobile unit so they don't miss a beat. And we're hoping we won't miss many beats either with the yellow vans. They'll be back on the street very soon. If you should wait to hear from a provider about appointment cancellation before you assume that your appointment will be canceled. Because as Josh said, many of our providers are making the switch and will be providing an mRNA vaccine. However, if you do hear from a provider that your appointment is canceled, you can reach out to our vaccine assistance line, the 211 line, and they will be happy to assist you. We do have appointments available for mRNA vaccines, and they'll assist you with rescheduling. And any appointments that we schedule today through the VAL will be for the mRNA vaccine. We won't be scheduling any J&J appointments.
Yeah, actually, just to build on that, in addition to the VAL, people can go on VAMS. I was actually just on there a moment ago. There are a number of Pfizer and Moderna appointments available today, tomorrow, and later in the week, as the governor signaled last week, or yesterday rather. This comes at a time when we are kind of working our way through our vaccination program. We're starting to see some additional slots open up. So if you do end up with an appointment canceled at any provider, we'd encourage you to call the VAL or go on VAMS, and you should be able to find another appointment for Pfizer and Moderna very quickly.
Thank you.
Ken Dixon, Hearst, Connecticut Media.
Thanks, Max. So it doesn't look like it's going to affect the schedule. You're not going to delay or roll back and say 16-year-olds hold off. It seems like you're going to pivot. Josh, yes?
Yeah, no, we're still full steam ahead for everyone to get vaccinated.
With 21,000 doses of J&J this week, I mean, what's going to happen to them? They're just going to sit in storage. I guess they can remain in storage for 3 months and still be effective.
Yes.
It's just kind of a wait and see thing, Commissioner?
Yes, it is. The CDC director and the FDA this morning said that the advisory committee on immunization practice and an FDA committee will be meeting this week. So I anticipate there'll be additional information forthcoming from them. But we don't have a time frame. We're hoping it will be short, obviously, but we don't have a definitive time frame from our federal partners.
And the clots they've found are in the brain then? You said cerebral?
That's right.
And what is this going to do, Commissioner, to the effort to overcome hesitancy in the state?
Well, as I said, we continue to emphasize the huge effectiveness, the really impressive effectiveness of these mRNA vaccines and the J&J vaccine of preventing hospitalization and death from COVID. And we will continue to emphasize the safety of those vaccines and encourage people to obviously get informed, ask and get your questions answered, but then weigh the benefit and risk. As the governor said, everything in life carries some level of risk. We know the risk of COVID is real. We've lost 7,000 people in Connecticut to COVID. We haven't lost anybody in Connecticut from this particular side effect of the J&J vaccine.
Thank you.
Fox 61.
Thanks, Max. With a lot of these mobile units targeting the high SBI communities, did someone speak to if we're expecting this lack of J&J to impact some of the state's equity goals?
I'll start with that. No. We're going to make sure that those vans continue, those mobile vans taking Moderna and Pfizer vaccine right to those very same communities and doing everything we can to make sure they get vaccinated.
All right. And switching to these mRNA vaccines, with all of these locations, including the mobile vans, are they equipped to handle the more rigorous cold storage requirements associated with those mRNA vaccines?
I believe they are.
Definitely the FEMA mobile unit. We added, the Griffin added a couple extra pharmacists there today, just to be sure that all of the procedures were able to be followed. We're going to have the Mrna probably on the yellow vans because the storage requirements are a little less rigorous. But we will always make sure that our vaccine providers are committed to this, that they are following all of the requirements of administration, whichever vaccine they have in their clinics.
And just one more, if I could, will the lack of the J&J vaccine impact the timeline, I guess, at all? You know, I think the state had said we're expecting supply to outpace demand by the end of April. Do we still expect that to be the case?
Josh?
Yes, we do. You know, and as previously referenced, right, we're already starting to see, you know, appointments fill up a little less quickly. So again, a key message here is if you're looking for a vaccine appointment, get online or call the bell and you should be able to get one quickly.
Channel 3 Eyewitness News.
Hi, Governor, I just wanted to follow up with Fox 61's question, which pretty much answered the question I had, and that is that you don't think this will affect the rollout, even though you got 21,000 doses this week of the J&J vaccine. You expect to make up for that given what's coming from the other vaccines.
Yeah, exactly. I think you're going to see a 7 or 8% increase in vaccines we get from Pfizer and Mrna next week. So I think, and as Josh just said, we do have some slack in the system. So feel free to get online, call 211. You can probably make a vaccination appointment within the next few days.
And the other question I had was guidance from pharmacies and others. I mean, there's so many providers now, clinics, et cetera. What guidance do you have for pharmacies who may have hundreds of doses of this vaccine? What do they do with it, and what do they tell people?
I can say that on the COVID task force, they said, look, this pause in J&J is going to be probably measured in days, not weeks. So, you know, sit tight with your J&J vaccine. I'd like to think that they're going to be able to do the tests and be able to roll that out again in the very near future.
And I guess briefly, you mentioned at the start of the call that you had a conference call with Dr. Fauci and others in Washington. How many other states are taking this action to put the vaccine on pause? Do you know?
Yeah, this is a CDC national, effort. So J&J has been taken off the shelves until further notice.
Okay. Thank you, Governor.
The Connecticut Mirror.
Hi, Governor. For the high SVI communities, were they more likely to get the J&J vaccine up until the point that this was paused?
Josh, you're best at that.
We don't have that split out. I don't think that's necessarily true, though. We've had a lot of our mass vaccinators administering J&J up to this point as well, but we don't have that split.
We have had, just to add to Josh's comment, we have had every vaccine available to every community. That was been a directive from our federal partners. So we haven't done one type of vaccine exclusive to any community at all. Everything's been sort of sprinkled around the state. The mobile units have, for obvious reasons, been using more J&J. They can pivot, as we've been saying.
And could you talk about how you guys will coordinate, or the providers who are doing the mobile units will coordinate those second dose appointments now that we're switching to the other types of vaccine?
Keep going, Deirdre.
Yes, so more to come on that. We know that people will need a second dose, and they'll get their card and the date that they need their second dose. Today, we may not be able to schedule that second appointment every time. The goal will be to get the second appointment scheduled at the time of the first. But today and possibly tomorrow, we're going to have to work through some of those glitches and work with other providers to make sure that people who get their first doses in the mobile units can get their second doses. We will plan for the FEMA van to make a second round if they need to administer a second round of vaccine.
Yeah, that was the only thing I was going to clarify. Is it more likely that the units themselves would deliver the second dose, or that folks would be directed to a clinic that could provide that?
We're going to make every effort to have the units administer the second dose, but we're not quite sure yet whether we'll be able to do that in all cases. So more to come on that as we work with our partners.
Thank you.
The CT Examiner. NBC Connecticut. The Associated Press.
Thanks, Max. Good afternoon. I was wondering how many providers besides the mobile units are using J&J, and really how big of a percentage of the rollout does that include?
You have that, Josh?
Sure. I mean, we have dozens of providers who have been using J&J at various points over the last month plus. Last week, which was our all-time record in terms of vaccine deliveries into the state of Connecticut. Johnson & Johnson was a significant percentage of that, about 40%. So it was a meaningful amount last week, but we still have robust supply of an inventory of Moderna and Pfizer. So we do think, as we indicated previously, that we have the levers to mitigate the impacts here and move additional Pfizer and Moderna around to be able to fill those appointment slots to a great extent.
And you guys said that you're going to be switching the folks that were supposed to get their shots through the FEMA unit to Pfizer. Is that going to be this an apples to apples vaccination rate? Are there the same number of people will get vaccinated today that were planning on getting the J&J?
Yes, that's the expectation at this point.
Okay, great. Thank you.
News 12 Connecticut.
Max, I know you mentioned, Governor, that the White House thinks that this, is a matter of days and not weeks. But at the beginning, you also said that a lot of the governors seem to think that was naive. Can you kind of go into how long you think this might last and why?
I don't think, John, that it's going to be a matter of days is naive, but that's up to the scientists and what they discover. I think what some of the governors, myself included, was, hey, it's not like you put this on pause and then the flag goes and gentlemen start your engines and the race starts again. I think you got to continue to build up confidence and to remind people. So this was a bit of a curveball. And so be careful when you use the word pause, because we got to continue to build people's confidence to get vaccinated. That may take a little bit longer now.
So do you think their timeline, though, is accurate that, we could get the all clear to start giving out the J&J again in a few days?
Yeah, I really can't opine on that. I hope so.
The Waterbury Republican American.
Thanks. I was just doing some quick math. You have 35 vans. They're capable of doing 160 doses each. At least that's what I had reported in the past. So that's what, 5,600 doses a day. How, you're going to be using a 2-dose vaccine. So, with what, 2 to 3 week delays in between the first and second doses. So how is this going to affect your plans towards getting the state vaccinated, moving towards, sort of herd immunity? It's going to take longer, correct?
I'll start with that. Paul, we're going to get probably a full dose of vaccines, very close to that, over the next couple of weeks. We're getting a big increase in allocation in Pfizer and Moderna. I think I'm less concerned right now about supply and becoming more concerned about demand, doing everything we can to make sure those vaccine hesitant get vaccinated. We make it easy for them to get vaccinated. We prioritized those mobile vans to make sure it is easy for them to get vaccinated.
Dr. Gifford?
Yeah,
Take 2 shots versus 1 shot, so it's got to take longer.
Well, it will take longer for those people to be fully vaccinated, since you're fully vaccinated 2 weeks after the J&J shot. So that's correct. Just to clarify on the mobile vans, we have 13 out on the road this week, not the full 35. We're building towards that number towards the end of the month. So it's not quite the number of doses that you suggested. So yes, it will take a couple of additional weeks for everyone to be fully vaccinated, but the majority of our vaccine was Moderna and Pfizer anyway, so it doesn't make a big dent in our goals towards herd immunity.
Okay, and just a sort of final question for me: what's being done to notify people who got a J&J shot yesterday, who got a J&J shot in the last 6 days? Our local health departments, is the Department of Public Health, our vaccine providers contacting these folks and informing them of the situation and what to look out for, and what they should do if they feel any of these symptoms coming on?
Deirdre?
Yes. So the department did put out a statement a few hours ago notifying the public if they have any of these very rare symptoms that they should reach out to their provider. We will be notifying our healthcare providers through a regular DPH bulletin later on today. We've also already reached out to our local health departments and vaccine providers with similar information. In addition to that, the FDA and CDC did a briefing at 10 a.m. this morning. We understand there'll be further briefings throughout the day. So the public can be aware that if they do have one of these very rare but severe symptoms, they should reach out to their doctor.
The Hartford Current.
Hey, everybody, this is Emily Brindley from The Current. I just wanted to ask about the state guidance to vaccine providers. Would somebody be able to explain what exactly that guidance said, if it was just to pause vaccinations or if there's more detailed information about how to handle appointments, and also what time this morning that went out to providers?
Do you have that, Deirdre?
I believe it went out about 9:30 this morning. If I recall. And the provider notice recommended that providers pause the use of the J&J vaccine, and that if they had available mRNA vaccine, they switch over using that vaccine instead. In addition, that they reach out to DPH if they had any questions or needed some assistance in switching over to the mRNA vaccine or with the questions about their supply.
And for right now, is the state advising providers to just hang on to those J&J doses since they might be able to use them again in a few days?
Yes.
Okay, thank you.
Connecticut Public Media.
Question about the wording. The CDC says pausing to see if there is a link, while the State Department of Health is talking about, quote, an extremely rare adverse reaction, as if the link's been established. Do you think you should be more cautious in the messaging to continue to encourage people to get vaccines, that this messaging could scare some people away?
I don't know about the messaging. I'll refer to these guys. It's a 1 in a million occurrence. 1 in a million. And right now, the CDC and FDA said, let's take a short pause, take a look at this, make sure we have all the answers before we get back to doing J&J along with the mRNA. I'd like to think this will be resolved by the end of the week.
NBC Connecticut.
Can you guys hear me now? It's Caitlin Burchell with NBC Connecticut.
Hey, Caitlin.
Yes. Hi, thank you. My apologies for a classic technical issue. My question's for Josh. Josh, can you just, and I apologize if I missed this, but quantitatively, we mentioned there's 21,000 J&J vaccines coming in this week. Just, how many are we getting of the other vaccines regularly now and going forward, just to give people an idea of what we're dealing with from a numbers perspective?
Sure. So for the vaccines arriving this week, we're getting 158,000 Moderna and Pfizer first doses, compared to 21,000 J&J. So for this week, it's only about 11 or 12% of our deliveries were Johnson & Johnson.
Thank you so much. And for the vaccine hotline, I mean, are you working with them as well to make sure that they're, finding new ways? Because that's obviously an equity issue as well for folks who don't have the internet that use that option.
Yes, we've been in touch with our partners at 211 this morning, and they've pivoted their staff to help people reschedule appointments if they need to, and also to answer people's questions if they have them about this issue.
Thank you very much.
News 8.
Good afternoon, it's Jody Latina. I just want to follow up on a question that was asked earlier about folks who might have symptoms. If they have the J&J shot, they should call their doctor, but is there also a process or a mechanism that they should be reporting to so that you're collecting data?
Deirdre?
Yes, I thank you for raising that. First of all, the providers will report to a national monitoring system called VAERS, Vaccine Adverse Event Recording System. So that's how these cases were detected, because providers do report into CDC. But people can sign up for something called vSafe on their phones, which is a way that they can submit any kind of symptoms or side effects they have to the vaccines, which is really helpful for just nationally kind of monitoring and continuing to learn more about how people react to the vaccine. So that's called vSafe, but the providers will report any adverse effects to the CDC and FDA through the VAERS.
And just a quick follow-up, how many community public health departments have reached out to switch over to the mRNA?
I don't know the answer to that question yet.
Thank you.
And final question, ABC News.
Hi, I'm so sorry for the background noise. There's a neighbor weed whacking. I wonder if we could talk about college students, because J&J has been intended for many college students before they leave for the summer. Can you talk about the effect this pause might have on that demographic and what you recommend colleges do now to prevent their students from spreading the virus further?
Go ahead, Josh.
Well, we had already made a decision to pivot away from Johnson & Johnson from our colleges and universities based on the declining amount of vaccine that we were previously expected to get due to the manufacturing issue that they experienced in Baltimore. So we had already been down the path of working with our colleges and universities to provide them with Pfizer or Moderna vaccine, and then partnering with other states to have second dose appointments available for them if students are returning to another state after college concludes. So we don't expect any additional impacts to our efforts to try to get college students vaccinated before the end of the year.
Do you think there might be a problem with a lot of college kids getting only one dose of a 2-dose shot?
Well, the governor is working with his fellow governors in the White House to try to minimize that risk by making it as easy as possible to have second dose clinics available across the states if students do return to a different state. We'll certainly be hosting many second dose clinics here in Connecticut, making it very easy for students who live in Connecticut, returning to Connecticut if they got their first dose somewhere else to get their second dose here. This will all be happening in kind of mid to late May timeframe, at which point in time we expect not just in Connecticut, but all 50 states to have significantly more vaccine supply than demand, just based on how the timelines are playing out.
Thanks.
Yeah, and remember, Moderna and Pfizer, after one shot, are 85% effective. But Josh is right. We're working with all the governors. We're going to try and get all of our college kids at least that first shot of vaccine, and we want all the other governors to do the same with their colleges. One of the last risks is the idea of tens of thousands, hundreds of thousands of kids flying back and forth. Hey, look, just when you think you see the daylight, you see the end zone, COVID sometimes throws you one more curveball. But I think this is one where, erring on the side of caution, We're going to be back to a normal state pretty soon. You know, the biggest concern I have is that it gives people a reason to pause. I think it should give you a reason to go get vaccinated with mRNA. Start that right now. We'll see what they say about Johnson & Johnson in the very near future. And we should know that CDC is paying special attention to public safety and health. And that's why they did what they did. Now you do what you do and get vaccinated. Thanks, everybody.